Welcome to PatientKeeper, OBHG's electronic charge capture platform. We're going to review your patient list tab and your inbox tab. These are the two tabs that you will use most in PatientKeeper. Your patient list tab shows the patients on your list. You have your actions tab, which is where you will add your patients. You can sort it, you can print it, you can show properties, and you can find other patient lists should you need to. Your hospital list will show any hospital programs that you are assigned to. You will just need to make sure to change the list if you are going to multiples. You want to make sure you're on the proper list to add your charges. The other tab is your inbox tab. This is your email system within PatientKeeper. It is only between you and your coder. You will see when we enter a charge into PatientKeeper, you have a field where you can ask a question of your coder. When she replies to that question, it is going to be in your inbox in PatientKeeper. You're not going to get emails from other providers from OBHG or any from the hospital. Again, it will be just between you and your coder. You may see a few emails from PatientKeeper when they do broadcast messages, but basically you're not going to get inundated with emails. It'll be basically between you and your coder. It is like most other email systems. You will not have any type of pop-up box or audible alert when you receive an email. You will just need to keep an eye on that inbox tab. When you log into PatientKeeper, if you have any messages, you'll see a number to the right of that inbox. And then you can just select the tab and review your PatientKeeper emails and respond to those if needed. Again, your patient list is where you are going to add your charges and you are going to add the patients if she is not already on the list. Chapter 2, Adding Patients to Your Patient List. On your Actions tab, select Add Patient. On your search options, type in the patient's last name, her first name, and your facility here. Everything else should be blank. We want to search broadly. We don't want to limit our search. So last name, first name, our facility. We're going to search for visits. We received no visits found. So that means this patient has never been added into PatientKeeper. Underneath, we see our options. These are the areas where we may have seen our patient in the main ER, inpatient, outpatient, or OBED, obstetrical service agreement, observation. Those are our most common areas. For this example, we will choose our OBED. We're going to fill in the blanks, so our patient's date of birth, her MRN number, the admit date or the date that we saw the patient, training hospital should populate here, and then we're going to choose our add and save. We're going to close our screen here and we will see our patient that we just added on our patient list. Our next option is to add a patient, and she already has a visit, but she's not on our list. So we're going to do our actions, add patient, first and last name, our facility, our search for visits. We do have a patient here. Our patient is in the system, and we have a visit for 7:30. So if that is our correct date, we simply select the patient, add patient to list, and hit our add button. When we close that, we'll see our patient is on our list, and we can add our charge. So we also may have an option, the patient may not be on our list, but she may have visits in the system for the date that we need. We'll go to our Actions tab, add patient, last name, first name, our facility, and our search for visit. So we see this patient does have visits. But say we need a visit for last week. So say we need a visit for 7:15, and we don't have a visit for 7:15. We can select any of these visits. We'll select the last visit for 7:30, but we need one for 7:15. We'll come to add visit. We're going to add an OBED visit. For our Colleton facility, our unit, doesn't matter which of those you choose, it just has to be filled in. And then our date of service. And add and save. And that is how you would add a visit if she's in our system, but we don't have a visit for that day. Chapter 3, Adding Patient Charges into PatientKeeper. Select your patient from the patient list. Verify charges is selected. Choose the red add for the appropriate date of service, and that will give you your charge transaction screen. Your patient information will be at the top, charge details on the left-hand side, diagnoses area, charge area, and then your final. This is where your diagnoses that you select and your charges that you select will populate. You want to start on the left-hand side on your charge details. Answer these questions, patient GYN only, yes or no. Verify that your date of service is correct. Enter your gravida and your para by selecting the search button and choosing your gravida and your para for that visit. The baby's weight is only needed for deliveries. So for this example, we leave that blank. This is an OBED visit, not a delivery. So we leave the baby's weight blank. Is this an OSA charge? For OBED or outpatient visits, that will always be no. Our OBED and outpatient visits are not a part of the OSA agreement. Requesting physician is her primary. You can search the list of available requesting physicians from the list. If she does not have a requesting, she's an unassigned patient, you can use the non-OBHG option. Our service site populated as an OBED. Our bill area, we will select that if it does not automatically populate to the hospital that you are currently at. Your billing provider will populate. Injury date and injury type, you only need that if the patient had some type of accident and there was an injury associated with that, and then she came in to be evaluated. The system will tell you based on a diagnosis code if that information is needed. So you leave it blank unless you are prompted to enter that information. Once you complete your charge details, you will come over to your diagnoses area and choose the appropriate diagnoses for the visit. We have several ways that you can search. You do have that search diagnoses option. You can search by ICD-10 code, by typing in a partial code. If you know a part of the code, you can type that in. You can type in verbiage and see those codes populate underneath. If you're comfortable searching, you can do that. We have existing, so this patient has been seen before in PatientKeeper, so we see that there are a couple of existing diagnoses. The training provider has saved some favorites, so you do have the option to save favorites to your settings as you go along, so you would see those under your favorites tab. And then under your department folders, you have pre-populated folders with the most common diagnoses in each of those groupings. So you could choose a folder. So say for false labor, you open that folder and you see those diagnoses. So for this example, we are going to use false labor at or after 37 completed weeks. So we would select that and it populates to the right. Now for our charges in PatientKeeper, we always, for our pregnant patients, we always have to have that gestational age. This is the specific week of gestation. We do have that gestational age folder, and we can open that and choose our appropriate gestational age. So you would code any diagnoses that you treated that patient for that visit. For this example, we're going to leave it at false labor and 39 weeks gestation. Once we have our appropriate diagnosis codes, we are going to come underneath to our charges. The same process, you have your search charges. You can search CPT code or CPT verbiage. You have a custom workflow, which is going to be your OSA tab, which we will look at further in another chapter. You have your favorites that you can save, and then you have your department folders. So your emergency department is where your emergency department, if you go to the main ER, or your OBED visits will be selected from the emergency department. We have a testing folder, so if you do any inpatient or outpatient testing, your BPPs, NSTs, or ultrasounds will be found under there. Your inpatient care, all of your inpatient hospital codes will be under that inpatient care. Labor and delivery services, when you do a delivery, will be under that folder. GYN procedures, if you do any of those, under that GYN procedures folder. Observation care, if you admit a patient into observation status, you have that folder. And then if your program is not an OBED but an outpatient program, you will use your outpatient E&M codes, whether it be outpatient new or outpatient established. And that is, again, for your outpatient programs. So we are an OBED program at this test program. And so we're going to use our emergency department folders and choose the appropriate visit level that we have documented. If you have a question, you need to know, well, what does the ER visit level 4 mean? You can come to the icon to the right, hover over that, and it will tell you that a level 4 chief complaint is medically appropriate, your exam, and the medical decision making is of a moderate complexity. And you would see that on any of those options, and you could look at that. You'll choose your appropriate visit level by selecting it, and it again will populate under your charges on the right-hand side. Once you do your charges, you have your diagnoses and your charge code. You will select your submit button here. That will give you your clinical metrics. You will enter those clinical metrics. Was she discharged, admitted to OBHG, or admitted to private? We're going to say we discharged this patient home. Was there maternal transfer? In, out, or not applicable. Most of ours are not applicable. And the maternal, fetal, or neonatal death is a yes only, so we leave that blank and we hit our submit button here. And that will be your OBED or inpatient, or my apologies, OBED or outpatient visit, depending on how your program operates. How to add a delivery charge to PatientKeeper. Select your patient. Click on the red add for your appropriate date of service. Charge details, patient GYN only, our date of service, our gravida, and our para. The baby's weight, so now we're doing the delivery. We select the search option and we use one of the 3 options. We cannot put in an exact weight, so we have to choose one of the 3 options. Is this an OSA charge? No, this patient is unassigned. She does not have a provider who has signed the OSA agreement. Our service site is inpatient. Our bill area is selected. Our billing provider populates. Our diagnoses, we have to have that gestational age. We'll select that first. 40 weeks. We'll choose for this example. We have to have a delivery outcome, and that is saved as a favorite here, single live birth. We can use that. Or we can find our labor and delivery folder and go to our delivery outcomes here and choose single live birth. Then we need to choose, are there any complications? So anything complicating the pregnancy, my apologies, not the pregnancy, anything complicating the delivery, fetal distress, preeclampsia, anything that's complicating that delivery, we would use. If there are no complications, she's full term, we can use the diagnosis code 080. encounter for full-term uncomplicated delivery. And we can only use that when she is full-term and there are no complications. We'll choose our diagnosis codes available. And then under our labor and delivery services, we will choose vaginal, VBAC, or C-section only. In this example, we will do our vaginal. So we have our charge details, we have our diagnoses, and we have our delivery. And we will submit the charge. We will answer our clinical metrics. What was the patient's disposition? Discharged, admitted to OBHG, or admitted to private? Was labor induced? Was there maternal transfer? Maternal, fetal, or neonatal death? Skip that if our answer is no. Did you use forceps? Did you use a vacuum? Was there a surgical episiotomy? Third or fourth degree laceration? And the 1 in 5 minute APGAR? And was this a multiple birth? Once we answer that multiple birth, we have our submit button. We'll select that. And there's our vaginal delivery for that charge. Chapter 4, Obstetrical Service Agreement, or OSA, adding charges to PatientKeeper. First, select your patient. Choose the red add for the date of service. You need to add your charge. And you will see the patient information at the top. You have your charge details, your diagnoses, and your charge area. For OSA agreements, you would see a custom workflow under that folder that will have the name of your program and the OSA tab. This custom workflow will show you any providers at your program who have signed the OSA agreement. If you click on that workflow, you will see the program and the providers who've signed the agreement. You should also have posted in your work room or your call room that list. You should have a printed list posted in your call room. If not, you do have this custom workflow available if there are any OSAs at your program. So we'll close that. To add an OSA charge, on your charge details, you're going to GYN only, your date of service, your gravida para, the baby's weight. Is this an OSA charge? Yes, it is, because we know this delivery is for Dr. Allen for this example, and he's on our list. Our requesting physician, type in his name and add Dr. Allen. We're going to change our service site from inpatient to OSA. So when we answer yes to the OSA charge, the requesting physician is on our list. Our service site will be OSA. Our bill area will be the name of our hospital and our billing provider. We leave the injury date, injury type blank unless it's prompted us to bill that. We need our diagnosis codes. We have to have that gestational age. For this example, I'm just going to use the 40 weeks from our existing. We have to have our delivery outcome. I'll again use our single live birth from our existing. And any complications that we have. For this example, let us say under our favorites, there's abnormality in fetal heart rate and rhythm complicating labor and delivery. And we'll just use that as our complication for this example. So we have our diagnosis codes. For our charge code under our custom workflow, we're going to open up that OSA tab. We're going to select the down arrow beside Dr. Allen's name. And these are our OSA codes. So if we only do labor management for this patient, we can choose labor management less than an hour or labor management greater than an hour if the only thing we're doing is labor management. Our deliveries, we have a vaginal delivery only or our vaginal delivery with labor management, C-section delivery only, C-section labor management and delivery, VBAC delivery only, or VBAC labor management and delivery. So depending on which type of delivery you do and whether you do labor management and delivery or the delivery only, you would choose the appropriate code from that. If you are rounding or discharging the patient, you will use the rounding/discharge only. or if you are needing to bill a no-charge delivery for vaginal C-section or VBAC. These three are only used if the provider arrives within 30 minutes of being notified. Whether you deliver or they take over and deliver, but they arrive within that 30 minutes of being notified, you would bill that as a no-charge delivery. So for this example, we're going to do a vaginal labor management and delivery. So we select that from the list, select our OK button. That populates our diagnoses and our OSA code to the right, and we will simply submit the charge. Our clinical metrics: what was the patient's disposition? Admitted to private, was labor induced, maternal transfer. We leave the maternal fetal neonatal death blank, forceps used, a vacuum, episiotomy, the lacerations, APGAR scores, multiple birth, and then submit that charge. So that is our OSA delivery codes. Again, if we look at the charge, the OSA charge, yes, that requesting physician, service side is OSA. Diagnoses are always going to be what they are: your gestational age, outcome, and any complications. And then your charge are going to come from that custom workflow for that particular provider. Chapter 5, Value Add Charges. OBHG has a list of items that we do not bill our patients, nor do we bill our program partners. It is a list of items that what we call one-offs. The provider calls and asks you to do a certain task, to review a strip. You're not following the patient. You're not going to treat the patient. You're just looking at this strip for the provider and reporting back to him or her. Or they ask you to rupture membranes. You should see a list. You have a list available, a tally sheet at the programs that lists all of these items, or you will see them at our first patient on the list, the AAA name of your program, value add. So this is where we capture those numbers. We don't bill anyone for those, but our hospital programs and OBHG likes to see all of that value added things that we're doing for our patients and our programs. You will see that value add item at the very first patient on your list, and you'll keep that tally sheet, and during your shift you'll keep that list, and you only want to put it in once. You don't want to have to go into the value add multiple times, so you just want to do it once. Usually that's at the end of your shift, and you'll put those numbers on the date that you started your shift. So if you select the value add patient from the list and select a date, we're going to choose the 23rd as our example. Choose that red ad. You'll see the value add patient at the top. You have your charge details, your diagnoses, and your charges, and then your area where your selections are held. On your charge details, for the value add, you only answer those with the red asterisk. Those are hard stops. You have to answer those. So GYN only, you can answer that no. Your date of service will populate. Is this an OSA charge? Will be no. Your requesting physician should be none OBHG for the value add, because again, we don't want patient-specific information. It's just a number. How many of these items are we providing? Service side is value add. Your bill area and billing provider populate. We have to have a diagnosis, but again, we don't want patient-specific, so we'll use the existing no charge diagnosis code that's available. We'll come to our custom workflow, and we'll see the hospital's value add patient underneath. We'll select that. That gives us all of our value add items. So if you do any medical student oversight, medical resident oversight, formal or informal, if you provide coverage for providers, how many providers and how many hours did you provide that coverage, any hospital staff education, formal or informal, on-site hospital committee meetings, phone ER consults where you don't see the patient, any patient phone calls, drill participation, reviewing the fetal heart rate tracings, proctoring private physicians or midwives, standby request undelivered, IUPC placement, placement of that IUPC, rupture of membranes, fetal scalp electrode placement, the OB medical screening exam. If for some reason you can't complete a full evaluation and management, you can put that information under your OB medical screening exam. High acuity support services. If you ever have a shift where you do not see patients, do the no patient seen for shift. TOLAC coverage, multidisciplinary board rounds, and if you have to call backup in. Midwifery student proctoring, the number of students and the total of hours. Induction prenatal record review, drill participation count, fetal monitoring strip count, OBHG-led discussion topics count, and then the proctoring private physicians or midwives number of hours. So you would simply come to the left, or my apologies, to the right. Say you covered for 4 providers. You will choose 4 providers. And how many hours during your shift did you cover? So we'll say 24 hours. If you do any ER phone consults, maybe you'll put that number in there. So you'll just fill out any of these items when that's the only thing you did for that patient. Maybe you ruptured a membrane. So you'll just fill out any of those with the number or time you spent doing that. Tell it okay. There's your no charge diagnoses and your value add numbers. And then you would submit those. And that would tell OBHG and our hospital partners, I spent some of my time on these items that we can't bill for, but we did provide that service for our patients and our hospital partners.